Hello and welcome to CE Institute. My name is Selena Belisle. I am the founder of the school and one of the instructors here where we teach medical massage. It's evidence-based clinical approaches that we follow from research to teach to our students. Today, in addition to providing an instructor demonstration of a 9-minute hand massage that I'm going to provide on a geriatric client in a seated chair, I'm also going to review 7 different pieces of research that show therapeutic outcomes for hand massage. Sometimes the hand massage is practiced by itself. Sometimes the hand massage is practiced with other things, such as foot massage, music, Reiki, and more. We hope you enjoy this, and if you do, please like and follow us on our YouTube station to help support our school. And thanks so much. Now, 7 of the hand massage research studies that I quickly pulled together here, just doing a search today of hand massage. This is a study it was a random control trial in RCT, which is considered the gold standard of research. And the title of the study is The Effective Hand and Foot Massage on Fatigue in Hemodialysis Patients. And the results were the hand and foot massage groups mean fatigue score. So their fatigue decreased after the application compared to the control group. Here is efficacy of hand and foot massage in anxiety and pain management following laparoscopic cholecystectomy, another random control trial, RCT. And they showed that a significant positive relationship was found between pain intensity and state anxiety levels of the foot massage and hand massage group. And foot and hand massage are influential in decreasing pain and anxiety levels after surgery for patients. And it's not just laparoscopic surgery here. There's many different medical interventions where they do hand massage before or after medical procedures, and they find that the client is more relaxed when they receive their hand massage. Here's another random control trial. Does hand massage have sustained effects on pain intensity and pain-related interference in the cardiac surgery critically ill? And their results were yes. The conclusion was hand massage could help patients experience longer periods without pain and lower levels of maximum pain intensity. In this pilot study, they practiced hand massage for cancer patients undergoing chemotherapy as outpatients. So for those who are oncology trained, if you can find the hands-on protocol for this, we won't be practicing this method. We're going to do a general hand massage to hopefully cover most of these research studies. But if you want the exact outcomes for the exact population of the study, you do need to look up their methods and interventions and try and practice them as close as possible. This routine was a 20-minute routine. I'm going to do about 9 minutes so that you can do 6 an hour, with a minute of sanitation between clients and so forth. A little 9-minute routine for you. The results of this is significant improvement after hand massage was indicated by VAS scores for fatigue, anxiety, muscle discomfort, nervousness, stress, happiness, energy, relaxation, calmness, and emotional well-being. Pain scores also improved. So we know that hand massage, even though we're just massaging the hands, they're having all types of effects for us hormonally, within the cardiovascular system and the nervous system and more. This is the effects of hand massage with a warm hand bath on sleep and relaxation in elderly women with disturbance of sleep. So geriatric women who have sleep problems, in their study with their protocol, their conclusion was a hand massage with a warm hand bath in the evening improved sleep efficiency and sleep onset latency in elderly women with sleep disturbance. And the results suggest that a hand bath and massage may improve subject sleep quality and relaxation. And this one actually, you see how it says free full text here? It does have a free full text. And they have a wonderful hands-on step-by-step protocol with this geriatric women's sleep disturbance pilot study. Was this a pilot one? No, it looks like a regular study. Okay, so this one they used a Japanese hand massage practice. They did a 20-minute hand massage, which is pretty typical for hand massage and research. You might find just 5-minute routines. I'm doing a 10-minute routine after I share all this research with you, and some of them are 20-minute routines. So you can add on with either the protocols in the research, or if they're very vague, you can adapt some of the styles and applications that we're going to show you. The intervention that they provided for the participants, the geriatric women with the sleep disturbance, is they started on the left hand and they proceeded as follows. They did massage of the forearm, massage wrist to finger, pulling an extension of the fingers. They massaged all the fingers. They massaged the hypothenar. They massaged the wrist. They had application pressure points. They did the dorsal side of the hand and more. And they even gave how long they did each of these. They started out with a warm water temperature bath. They showed the exact temperature of the water bath, and they even said what type of massage cream they used for the hand massage. They had 2 grams of fragrance-free massage cream of this brand. It looks like it's manufactured in Tokyo. And, you know, with each routine, they did 60 seconds, 90 seconds, 30 seconds, and more. So this is a great protocol if you have geriatric women with sleep disturbance and, you know, they're a little bit apprehensive of a massage. Hand massage is a great safe place to start. Nobody has to get undressed. And you can show from research that it actually improved sleep quality for that audience. Now, sometimes hand massage is practiced with other modalities. In this study, they did hand massage with music therapy. And it was in an pediatric intensive care unit to treat pain, fear, and stress. And their conclusions was it was determined that hand massage and music therapy were more effective than standard care at reducing pain and fear levels for 12 to 18-year-olds in the PICU, specifically with blood draw, so when they're having their blood taken, right? And here is another study of effects of Reiki in hand massage for pain and fatigue with clients who have rheumatoid arthritis. Okay, and their conclusion was it's recommended to use hand massage and Reiki in managing the symptoms and providing patients with care. So if you practice Reiki, you might want to look up the intervention that was used with this research, and then you can probably use some of the hand massage that you already know, whatever's included with the research, with Reiki to try and provide that therapeutic benefit. The first thing that we're going to do is place a towel underneath the hand, and this keeps the armrest a little bit more tidy. I'm going to use an unscented massage cream here and just lotion on some of the hand, lower arm, get some good glide going here so that I can do some great Swedish work throughout the hand, thenar eminence, and lower arm. We're going to do some compressions on the upper arm when we finish the lower arm and hand, just for a second, when we finish the routine. So now we're money signing each individual finger. You want to money sign from distal to proximal, working upwards with proper venous return. Okay, make sure you're never pulling the blood backwards towards the fingertips. That would just be bad physiologically and biologically. Now we're using our thumb pads to glide in between the metatarsals. That is number 4 on your 10-minute hand routine. Now we're just going to glide up the lower arm, just do some gliding friction. This is number 5 on your routine. Use both hands and alternate hands. Now we're going to do 1,000 needles across the carpals. This is number 6 on your 10-minute routine, and we're switching hands so we can get 1,000 needles both directions. Now we're taking our pinkies and inserting them between the thumb and the pointer and the ring finger and the pinky finger to get our thumb pads in here and do some circular friction. Now we're going to flex the client's elbow, and we're going to put our pointer fingers in between the client's same fingers. And this is number 8. We're just doing some more circular friction through the palm of the client's hand. Now we're interlacing fingers, and as we extend the wrist, we're doing some effleurage down the arm. We're switching our hands and effleuraging again with extension. All right. And keep in mind, we have to work very quickly. This is a 9-minute routine working on both arms and hands. We're doing circumduction in both directions with the carpals here. And now we're putting our thumbs over the carpals and flexing the wrist with a little bit of bounce, some thenar eminence spreading on the back of the hand and up the forearm. Feels really wonderful for the client. Always working proximal to distal, hand over hand effleuraging. Back to tracing a little bit of the carpals and money signing 2 fingers at a time and keeping those thumbs going with a gliding effleurage up the arm. So money signing 2 fingers and gliding up. This is number 12 on your routine. And you can do any form of hand massage you'd like to do here, whatever works best for you. Some more circular frictions in the palm or fascia of the client's hand while they're supinated, and thumbs up the flexors of the arm, the forearm. These are just suggestions on how you can get a 9-minute hand and arm routine in. It's great for people who are at computers all day. We're taking our paper towel now, drying off any excess lotion, and we're going to move over to the other hand and arm and repeat the same series. We're about 4 minutes and 13 seconds here into our first hand, so it's even on both sides. Some compressions on the upper arm. You can spend as much time. If they want more upper arm work, you can do less time on the lower arm and spend a little bit longer just doing compressions and so forth on the upper arm, whatever works best for you. You can even petrissage through clothing. Just make sure your hands are fairly dry and you're not spreading lotion all over the client's clothing. So we're coming over to the second hand and repeating the same series that we just did. A little bit of lotion on the client's hand and arm. It's great moisturizing, especially for geriatrics and in hospice scenarios. And we're going to money sign that hand again. Money signed the fingers individually. We're using our thumb to actually scrape through the metacarpals on this side. Whatever makes most sense for you and your client. Now we're taking our thumbs and really tracing in between the metacarpals and massaging up the arm. I'm going right into 1,000 needles right away. And that's that friction burn along the carpals. We're using both hands, so we're really getting a good circumferential coverage. Now we're going to interlace our pinkies here, and we're going to do our thumbs in the client's thenar eminence. You might have a better view on the left side of your screen. And right now we're doing like an alternating circular friction. All of this is written down on your 2-page, 10-minute hand and arm massage and on-site or relaxing chair routine in your student files. Make sure you get those downloaded. We're going to flex the client's elbow in a pronated position with palm towards you. Interlace our pointer fingers. Now we're going to interlace most of our fingers, not all. We're just trying to make sure you can see this on the camera angle here in the second camera. As we extend the wrist, we're moving down from distal to proximal and just trying to effleurage that blood in a venous return with a lighter glide back. Now we're doing some circumduction of the wrist in clockwise and counterclockwise direction. Doesn't matter which direction you start first. We're money signing 2 fingers at a time and continuing that glide friction up the lower arm. There's a little bit, this client's a melanoma survivor, and whenever I see any like new moles on him, I always point them out to him right away. Make sure that sometimes I take pictures of them for him with his cell phone and have him show it to the doctor. Continuing our circular friction in the palm and through the lower arm and the forearm flexors here. Getting some nice massage in there. I love circular friction. Hand over hand effleuraging from the carpals all the way to the elbow. If they don't have a shirt on, if they have a sleeveless shirt, you could go keep that going right up to the deltoid. And we're going back and scraping through the metacarpals again. And you can do whatever feels natural. If the client enjoys something, you see them smiling. We're back to our carpal bounce with the thumbs over the carpals and the fingers underneath the hand, pushing up on the hand and letting it fall. Some more compression type circular friction up the lower arm, alternating that compression circular friction feels really lovely for the client. Money signing the fingers some more. And you don't have to do the hand massage in the order just like we did. You can do it in whatever order makes most sense for you. Now we're going to dry off the hand and any excess lotion. Mind you, this is drying your own hand when you do this as well. And from there, we're going to go into some compressions of the client's arm. And you can see the client looking fondly now. He really enjoyed his hand massage.